Vitamin D, often referred to as the sunshine vitamin, plays a vital role in maintaining overall health, supporting bone density, immune function, and hormonal balance. Yet, despite its critical importance, many people experience a subtle deficiency without noticing immediate symptoms. This silent shortfall can gradually impact multiple body systems, often manifesting in ways that are easy to overlook. Understanding the early signs is essential for timely intervention and long-term well-being. One of the first indicators of insufficient vitamin D is persistent fatigue or low energy levels. People may find themselves unusually tired even after adequate sleep, struggling to complete daily activities, or feeling drained during routine tasks. This fatigue often stems from impaired muscle function, as vitamin D is crucial for muscle strength and endurance. Weakness in muscles may be subtle initially but gradually progresses, making physical effort more challenging and contributing to a sense of constant exhaustion. The second common sign is bone and joint discomfort. Vitamin D deficiency can compromise calcium absorption, weakening bones over time and leading to pain or tenderness in the lower back, hips, or legs. Some individuals may notice aching joints, particularly in the knees or wrists, which can be mistaken for normal wear and tear, aging, or minor injuries. The cumulative effect of this deficiency can subtly alter posture or movement patterns, creating tension in muscles and connective tissues, and sometimes resulting in minor, persistent aches that seem resistant to typical remedies like rest or over-the-counter pain relievers. Another less obvious but telling symptom is frequent illness or infection. Vitamin D is a key regulator of the immune system, helping the body produce antimicrobial peptides that fight off bacteria and viruses. When levels are insufficient, the body's immune defenses are compromised, making colds, flu, or other infections more likely or more severe. Some people may notice that even mild illnesses last longer than usual, or that they feel more susceptible to seasonal infections despite following good hygiene practices and maintaining a healthy lifestyle. Beyond physical symptoms, mood changes can also signal a vitamin D shortage. Research has shown a link between low vitamin D levels and mood disorders, including depression and seasonal affective disorder. Individuals may experience feelings of sadness, irritability, or anxiety without an apparent cause or find that their overall sense of well-being is diminished. These psychological effects may be subtle, developing gradually and often overlooked as stress or fatigue from daily life, yet they can be directly tied to the vitamin D deficit influencing neurotransmitter production and brain function. Cognitive challenges are another warning sign. Insufficient vitamin D has been associated with difficulties in concentration, memory lapses, and reduced cognitive performance. This may manifest as forgetfulness, trouble focusing at work or school, or an inability to maintain mental clarity during complex tasks. Over time, these cognitive impairments can impact productivity, learning, and daily problem solving, making it crucial to recognize this connection early. Additionally, hair thinning or hair loss can be an external indication of a deficiency. Vitamin D contributes to the hair growth cycle by supporting follicle health, and a lack of it can disrupt the normal cycle, leading to shedding or slower growth. Individuals might notice their hair becoming brittle, dry, or sparse, especially along the scalp's crown or hairline. Skin health can also be affected, with dryness, irritation, or eczema flare-ups occurring more frequently, since vitamin D supports skin cell growth and repair. Digestive issues such as persistent bloating, diarrhea, or other gastrointestinal discomfort may be indirectly linked to vitamin D insufficiency, particularly if the deficiency is connected to poor absorption due to conditions like celiac disease, Crohn's disease, or other malabsorption syndromes. Even subtle reductions in appetite or unexpected weight changes can sometimes correlate with this nutrient gap. The cumulative impact of these symptoms may seem unrelated at first, with fatigue, aches, mood changes, or hair thinning appearing as isolated concerns. However, when several signs present simultaneously or persist over weeks or months, vitamin D deficiency becomes a likely contributing factor. The long-term consequences of ignoring this deficiency are significant, increasing the risk of osteoporosis, cardiovascular issues, weakened immunity, and metabolic disturbances. Early detection, ideally through a blood test measuring 25-hydroxy-vitamin D levels, allows for targeted intervention through lifestyle modifications such as safe sun exposure, dietary adjustments including fatty fish, fortified foods, and supplementation when necessary. Continuing from the earlier discussion, addressing vitamin D deficiency involves both preventive and corrective measures. Consistent exposure to sunlight is the most natural way to boost vitamin D synthesis in the skin. Spending 10 to 30 minutes in the sun several times per week, depending on skin tone, geographic location, and season, can significantly enhance production. However, excessive sun exposure carries risks such as skin aging and cancer, so balance and protective measures are essential. Dietary intake also plays a crucial role. Incorporating foods rich in vitamin D, such as fatty fish like salmon, mackerel, and sardines, can provide substantial amounts of this nutrient. Egg yolks, fortified dairy products, plant-based milk alternatives, and fortified cereals further support daily requirements. For individuals with dietary restrictions or limited sun exposure, vitamin D supplementation may be necessary, typically in the form of vitamin D3, which is most efficiently utilized by the body. Regular monitoring through blood tests is recommended to ensure levels reach and maintain the optimal range, usually between 30 and 50 mg/ml, though exact targets may vary based on age, health status, and medical guidance. Physical activity complements vitamin D's effects on bone and muscle health. Weight-bearing exercises like walking, jogging, resistance training, and yoga stimulate bone remodeling and muscle strength, enhancing the benefits of adequate vitamin D levels. Engaging in regular exercise also improves circulation and lymphatic function, indirectly supporting nutrient delivery and waste removal in tissues, which is particularly beneficial for maintaining energy levels and reducing fatigue. Addressing deficiency early can prevent the development of secondary health complications. Inadequate vitamin D over time may lead to rickets in children, characterized by soft, weak bones and skeletal deformities. And in adults, it can result in osteomalacia, producing bone pain, muscle weakness, and an increased risk of fractures. Beyond musculoskeletal issues, deficiency can influence cardiovascular health, increasing susceptibility to hypertension, heart disease, and metabolic disorders. Furthermore, immune modulation provided by vitamin D is critical in reducing chronic inflammation, autoimmune responses, and susceptibility to infections, making its maintenance essential for long-term resilience. Emerging research also highlights vitamin D's impact on mental health and neurological function. Low levels have been linked to depression, seasonal affective disorder, cognitive decline, and even increased risk for neurodegenerative conditions. Ensuring sufficient vitamin D can support neurotransmitter regulation, cognitive performance, and overall brain function, contributing to emotional stability and mental clarity. For those experiencing subtle symptoms like fatigue, muscle weakness, or mood changes, early intervention through supplementation or lifestyle modification can dramatically improve quality of life. Importantly, combining strategies amplifies results. Adequate sun exposure, nutrient-rich foods, regular exercise, and, when indicated, supplementation create a synergistic effect that optimizes bodily function. Individuals with certain risk factors, such as older adults, those with darker skin tones, individuals living in higher latitudes, people with limited outdoor activity, or those with gastrointestinal absorption issues, should be especially vigilant. Tailored approaches under medical supervision ensure safe and effective correction of deficiency, minimizing potential side effects and achieving sustainable outcomes. In addition to personal health benefits, maintaining optimal vitamin D levels contributes to better immune system performance, supporting resistance to infections, and promoting faster recovery from illnesses. By recognizing early signs and acting promptly, individuals can prevent long-term skeletal, muscular, and metabolic complications. Regular checkups, lifestyle adjustments, and informed nutritional choices work together to maintain adequate vitamin D status. Ultimately, the silent warning signs, fatigue, bone or joint discomfort, mood changes, hair thinning, and susceptibility to illness, should not be ignored. Recognizing these markers empowers proactive intervention, ensuring that vitamin D deficiency does not undermine health, vitality, or daily performance. Awareness, consistent action, and monitoring are key to restoring and maintaining optimal levels, providing a foundation for stronger bones, healthier muscles, improved mental health, and overall resilience. Prioritizing vitamin D is a simple yet profoundly impactful strategy for long-term wellness and prevention of numerous chronic conditions.